This podcast has been developed by Dr. Schrager and Sadowski in conjunction with the University of Wisconsin School of Medicine and Public Health, Office of Faculty Development. This presentation is geared towards assistant professors on all tracks. However, associate and full professors will find this information useful as well, particularly for mentoring your junior faculty. This presentation will describe the 3 tracks faculty may be hired on at the University of Wisconsin School of Medicine and Public Health. During the discussion of the tracks, I will relate what portion of the faculty's work time is typically spent on clinical and academic or scholarly pursuits. We will also review time to promotion, clock extensions, and transferring tracks. There are 3 tracks a faculty member can be hired on: the clinician teacher track, the CHS track or clinical health sciences track, or the tenure track. When you receive your letter of appointment, it will clearly state which track you are on. It is important to note that the division of your work time spent on scholarly and clinical pursuits will vary by the track you are on and by the expectations of your department chairperson. Although this presentation will provide relevant information on the different tracks, there is more detailed information located on the University of Wisconsin School of Medicine and Public Health website at www.med.wisc.edu under Information for Faculty and Staff. By clicking on this icon, you will go to the UW School of Medicine and Public Health intranet. Once on the intranet, click under Human Resources, then click on Appointments, Reappointments, and Promotions. And finally, a list of documents will come up, and clicking on Faculty Track Roles will give you more information on the different tracks at the University of Wisconsin School of Medicine and Public Health. Before describing the 3 potential career tracks a faculty can be hired on, I want to briefly mention area of excellence and significant accomplishment. On the clinician teacher track, your area of excellence is clinical, and you do not need an area of significant accomplishment. However, engaging in an area of significant accomplishment such as service or teaching is possible. For more details, please visit the website. On the CHS track, you need to choose an area of excellence, which will be your primary area of scholarly work, and an area of significant accomplishment, which will be your secondary area of scholarly work. There are 4 areas you may choose from as your area of focus on the CHS track. These are research, teaching, clinical, and leadership. On the tenure track, the 4 areas you may choose from as a focus of your scholarly activity are research, teaching, service, and outreach. Again, for more information, please visit the medical school website. For all faculty, it is important to find strong, supportive mentors who can help you develop a career plan and help you identify an area of excellence and significant accomplishment based on your scholarly focus and job description. It is important to find mentors early in your career so that you can be successful clinically and academically. Both mentors within your department and outside your department are helpful and beneficial to your career. Now let us review the details for each track at the University of Wisconsin School of Medicine and Public Health. First, we will review the CT track. Most faculty on the CT track will spend the majority of their time on clinical work and little or no time on scholarly activities. On the CT track, you will be promoted because you have been a practicing clinician for a minimum of 5 years and you are highly regarded by your colleagues and referring physicians. You may teach residents, participate in departmental, hospital, or medical school committees, but none of this is required to be promoted. Most CHS faculty will spend greater than 50% of their time on clinical care, and the remaining time will be performing scholarly activity. As a faculty member on the CHS track, you will need to demonstrate a regional reputation to be promoted to associate professor. One way to demonstrate you have a regional reputation is by being invited to speak at regional conferences about your area of scholarly activity. Publishing in your area of scholarly activity and service to societies is also highly encouraged for a strong promotion packet. Unlike tenure track, extramural funding would be a plus for someone on the CHS track, but is not required. Most tenure track faculty will spend at least 50% of their time performing scholarly activities, and the remaining time may be clinical, teaching, or service to your department or medical school. The most common scholarly activities of tenure track faculty involve research, and they develop this as their area of excellence, although you can pursue teaching, service, or an integrated packet. In order to be promoted on the tenure track, you need to demonstrate an exceptional record of scholarly activity, which includes, but is not limited to, strong national presence at conferences, prolific publishing, which includes original research articles, review articles, books, and chapters, participation on editorial boards and as officers of professional societies, and you will have to obtain extramural funding to support your scholarly activity. Your promotion clock is the amount of time you are given to be promoted from assistant to associate professor on the CHS and tenure tracks. There is no promotion clock on the clinician teacher track. Please be aware that there are full-time and part-time clocks. If you are hired and your FTE is between 50 and 75%, you are on a half-time clock. If you are hired and your FTE is 76 to 100%, you are on a full-time clock. For more information, please visit the medical school website. If you are on the CT track, you do not have a time limit by which you need to get promoted. However, you need to be in practice for a minimum of 5 years before you can go up from assistant to associate professor. If you are on the CHS track, you essentially have 8 promotion clock years to be promoted from assistant to associate professor. Please note, this means you will need to put your promotion packet together in the beginning of your 8th clock year so you can submit your promotion packet in January of your 8th clock year. The medical school deadline for submitting packets is January of each year. Therefore, if you are hired in July of 2010, your first clock year is July 2010 to June 2011. Your second clock year is July 2011 to June 2012, and so on. Your 8th clock year would be July 2017 to June 2018. You would want to assemble your promotion packet by July or August of 2017, which your department needs to approve and send to the medical school by January of 2018. You then would hear about being promoted in the spring of 2018. On tenure track, you must be promoted from assistant to associate professor by the end of your 6th clock year. Please note, this means you must submit your promotion packet by your 6th full promotion clock year. Therefore, if you are hired in July of 2010, your first clock year is July 2010 to June 2011, and your 6th clock year would be July 2015 to June 2016. You'd want to assemble your promotion packet by July or August of 2015, which your department needs to approve and send to the medical school by January 2016. You would then hear about being promoted in the spring of 2016. Extension of your time clock is possible for certain circumstances, including childbirth and adoption, dependent care obligations, disabilities or chronic illnesses, and other circumstances beyond the faculty's control. Clock extensions must be made in writing per the guidelines found on the UW School of Medicine and Public Health Human Resources website, and usually involve a letter you write to the dean of the medical school through the chair of your department. Your faculty development or promotions coordinator or chairperson in your department can assist you. Kelly Lee in the Office of Human Resources in the University of Wisconsin School of Medicine and Public Health is also available. Occasionally, the track you are hired on does not fit your clinical or academic work and deviates from your career goals, or your job responsibilities change. In these cases, a track transfer is potentially possible. A case must be built with your chair's input and should be based on evidence that there has been a clear change in your responsibilities or expectations, or that you were placed on an inappropriate track when you were hired. Transfers have time constraints based on the track and rank of the faculty. Please see the University of Wisconsin School of Medicine and Public Health website for details. Kelly Lee in the Dean's office is also available. This is the end of the podcast, and I hope you have found some of this information useful for your career here at the University of Wisconsin. If you do need more information, please remember to visit the School of Medicine and Public Health website under Human Resources, where you can find more detailed information regarding tracks, promotion, time clocks, and transferring tracks, or talk to your promotions coordinator or faculty development person in your department. In addition to your department's promotion coordinator or human resource person, Christine Greger in the Office of Human Resources may help with promotions, and Kelly Lee in the Office of Human Resources can help with track transfers and clock extensions. Thank you for your attention.